Tens or even hundreds of thousands of Medicare Advantage enrollees in the next couple weeks are going to be getting a letter saying that their policy is going away at the end of the year and that they're just going to be in original Medicare come 2026. Now, while this might make you feel overwhelmed, it might make you feel a bit panicked, just know that this is actually far more common than you might realize, which means that there are things you can do to protect yourself and make sure that you're not totally blindsided by this. So once again, I am Ken from NJ Life and Health. We are here to give you a free video to better understand what happens when you get that dreaded letter that your Medicare Advantage plan is going away at the end of the year. In this video, it's going to be very quick, maybe 10-15 minutes tops. We're going to have a timetable of what you should expect if you get this letter in 2025. We're going to be going through your different options in terms of how you can sign up for new coverage, and we're also going to be talking about what you should be looking out for if your plan is going away in terms of what your new coverage options are going to be. Again, this is going to be super succinct, not a lot of fat on the bones of this video. We want to be as quick as possible. But before we go forward, I want to give you some expert advice from a brokerage that has helped 5,000 people with their Medicare. The biggest mistake you can make as a Medicare enrollee is assuming that everything is going to be the same in the upcoming year. As a brokerage, we talk to all of our clients every year to let them know what is going to change with their plans, and the only constant in the Medicare space is change. Be it your premiums are changing, they could be going up or down, the list of drugs a plan covers could be changing, the network of doctors available to you is changing. There are so many things that could change with your policy each year. You have to stay on top of it. That's what we do with our clients, but if you're not one of our clients at the moment, know that you have to stay on top of this stuff and you have to make sure that you are not totally blindsided come the next year. So the specific example we're going to give is the assumption that your Medicare Advantage plan is going away at the end of the calendar year 2025. There are a bunch of other situations you could be running into. Everything in the insurance space has to be very general because there's always exceptions to rules and little things, but we're just going to be assuming that you get a letter in September or October saying that your Medicare Advantage plan is going away at the end of the year. Now, in this timeline, new plans for the upcoming year 2026 are going to become public on October 1st. This is very standard. They're getting everything together. They're looking for approval by Medicare, and they finally make them public on Medicare.gov come October 1st. You then have annual enrollment from October 15th to December 7th. This is the time every year where you can go through your Medicare Advantage plan, your drug plan, in some states your Medicare supplement plan, and decide what you want to do for the upcoming year. In this particular example, at the end of the calendar year 2025, you're going to be disenrolled from your Medicare Advantage plan you're currently in and put in just original Medicare come January 1st, 2026. So if you're getting a letter in the mail, always look through the specifics. I can't give you every situation in one video, but this is most likely what you're looking at with your particular plan. Now, what can you do? So just so you're not totally shocked, there are a couple different options you can go through. So the first one is you can just enroll in a new Medicare Advantage plan in your area from October 15th to December 7th. This is the time everybody else is using to potentially just change their plan. You can look through all your options. You can talk to a broker like us. You can, check Medicare.gov. You can go to your local SHIP office, whatever it might be. This is the standard time you can decide to change a Medicare Advantage plan if you want to. You also have a little bit more time. So we're going to talk about this in the next slide, but Medicare Advantage plans in this specific instance have something called a special enrollment period. That's what you see with the SEP in the graphic in front of you. This basically means from November 1st of the calendar year 2025 to January 31st, calendar year 2026, you're given a new special enrollment period where you're able to also choose a new Medicare Advantage plan, a new prescription drug plan, something along those lines. This is what happens when a Medicare Advantage plan leaves the market. So if for some reason you don't realize till December 8th that you are losing your Medicare Advantage plan, you will be given the rest of the month of December to change. And if you totally miss the boat, you could early in 2026 as well for a month. Now, come January 1st, one option, just to be transparent, is you can just keep original Medicare. Now, we basically never recommend this because there's some pretty big coverage gaps with original Medicare, and there is no out-of-pocket maximum to speak of. So 20% of, let's say chemotherapy, dialysis, whatever it might be, without a Medicare supplement or without the out-of-pocket max of a Medicare Advantage plan, that is a ton of money potentially coming out of your pocket. We're talking tens of thousands of dollars very quickly. So I'm just going to be transparent and tell you, you can do this. We just really don't recommend it. If you've been in the Medicare Advantage system for a while and you want to try your luck with original Medicare plus a Medicare supplement, during this period, you can go through underwriting to go into a Medicare supplement. Now, this isn't particularly tied to any enrollment period. In most cases, Medicare supplements have rolling enrollment, and what you have to do is go through underwriting. That's what the UW in this graphic talks about. This is basically the process of the insurance carrier you're applying for, let's say a Medicare supplement plan G, saying you are healthy enough to go into this plan. It is a super common misconception with the advent of Obamacare or the ACA, whatever you want to call it. There still are certain types of health insurance that can deny you based on pre-existing conditions, and in a lot of states, Medicare supplements, that is the case. So for here in New Jersey, for example, when you first turn 65, when you first take Part B due to disability or due to retiring, you can waive all the health questions and everything like that. But anytime outside of that, you're most likely going to be asked, did you have cancer the past 2 years? Have you had a heart attack the past 2 years? Do you have any chronic conditions like Alzheimer's or dementia? Are you currently going through dialysis? It's usually much more serious chronic conditions. But just so you know, in a lot of states, insurance carriers reserve the right to potentially deny your enrollment into a Medicare supplement. Now, sometimes when your Medicare Advantage plan leaves a network, you are in some instances able to get what's known as guaranteed issue. This is basically where you're able to waive the health questions, waive any health inquiries they might have into your health history, and just get into a Medicare supplement, no questions asked. There are also a couple states like New York and Connecticut that have implemented guaranteed issue across all Medicare supplements, which means that no matter what happens, really any time of year in most cases, you can go into a Medicare supplement and there aren't going to be any health questions. Just know that if you're going through a guaranteed issue option, it's probably going to be more expensive. So you have plenty of options. Don't fret. It might seem overwhelming, but as we're showing here, you can choose a new Medicare Advantage plan. You could potentially get into a Medicare supplement. There's a bunch of different things for you to do. Now, I just want to let you know you technically have time after your plan is gone to go into another Medicare Advantage plan. So in this example, we're talking about a policy ending at the end of the year, calendar year 2025. Based on the Medicare.gov website, you're going to have a full month after that to go into a new Medicare Advantage plan. However, that new plan probably isn't going to start until February 1st, 2026. So if you apply for a Medicare Advantage plan in January for this specific special enrollment period I pulled from Medicare.gov, you are going to unfortunately not have that Medicare Advantage plan until February 1st because all these plans are pretty much on a month-to-month basis. So what we want to tell you as a Medicare brokerage is be more proactive. We are telling you now, the biggest mistake you can make as a Medicare enrollee is to not be proactive, to assume that everything is going to stay the same. There aren't going to be any major changes. And when that happens, that's when people get into trouble and they get frustrated because they didn't realize there was a major change and now they feel blindsided. So we are telling you now, this is early September when we're recording this. Be vigilant with your mail. Talk to your broker if you have one. Talk to us if you don't and you want some help with this stuff because we're here to help. But again, be proactive. I cannot hammer this home enough, guys. Now, if your plan is going away, there's a couple different things you should look out for. So the first thing to know is just because your current plan is going away doesn't necessarily mean the insurance carrier you've been working with for many years is also going away. So what happens is in many cases in your particular area, each insurance carrier might have, let's say, 2 to 6 plans available, maybe even more. What happens year over year is they experiment, they see what works, what helps their bottom line, what people seem to like, and they just say, okay, we have 5 plans in this area, we really only need 3. And if you're in one of the 2 that's getting cut, it might be one of those things where you're worried, oh my God, it's going away, but you could probably go into a similar plan in your area from that same insurance carrier, and your experience hopefully won't change too much. So again, just because your particular plan is going away doesn't mean the insurance carrier you've been working with hasn't, made a similar offering in your area. Now, if you are switching plans, or even if you're trying to stay within the same carrier, you're going to want to double check that all your doctors take whatever plan you're about to take. These doctors' networks change all the time. So I would say at the end of pretty much every year, you should talk to your doctor's offices and just say, hey, I've been rolling with this company for a very long time. I'm thinking about this company. Do you guys like this? You're going to want to take your healthcare into your own hands, have the conversations with the doctor's office. In many cases, when we've talked to doctor's offices, just because we're all on the same street, we have dozens of doctor's offices like within the square mile around us. They're always very candid when we're just kind of hanging out with them about what insurance carriers they like, what plans they like, and they will probably be very candid with you as well, so you can better protect yourself and make sure that your doctors continue to use the plan that you want to use. You're also going to want to double check that your prescriptions are covered. Every single Medicare Advantage plan that has drug coverage has something called a formulary. This is a list of the drugs that they cover and at what rates they cover them. So this stuff changes all the time. I cannot tell you guys enough. I feel like drug coverage is one of the most subject to change things in all the Medicare space. So just because your drug is currently covered at a good rate or covered in general, don't make the assumption it's going to be that way the next year. Always double check when you are looking into a new plan. You're also going to want to double check, are the copays and costs similar? If you're paying $20 for a specialist copay, is this new plan you're looking into going to have a $40 specialist copay, a $50 specialist copay? What are the costs associated with hospital stays and, chemotherapy and all these very expensive costs? You're going to want to double check all these things so you're not totally blindsided when you go to the doctor in January and all of a sudden the cost of whatever you need is double what you expected it to be. And then finally, you can look into the extra perks this Medicare Advantage plan you're looking into might have as well. Does it have a gym membership? Does it have good dental? Does it have a Part B give back? That's where they, give you money back on your Social Security check so that your Medicare costs are a little bit less month over month. Now, to be totally transparent, this is something we kind of look at as the icing on top of the cake. We usually want to focus on your doctors. We want to focus on your healthcare costs before anything else. But we do have a lot of people who say, Ken, I haven't been to the doctor in 10 years. All I want is the biggest give back. All I want is the best dental. All I want is the best over-the-counter benefit. So we absolutely do that as well. Really, you want to go into your decisions and prioritize what is most important to me. Is it seeing my 4 doctors? Is it this specific medication I'm on? Is it dental coverage because I have a major dental work coming up? These are all things you should be thinking about when you are about to move Medicare Advantage plans, or, your plan is going away and you need something new. And I just wanted to do a quick exercise before I let you guys go to tell you that if your plan is going away, and let's say your insurance carrier in general is just leaving the area that you're in, and you say, I've been with this company for 5 years, I'm worried what's going to happen. A little industry secret is, in many cases, in terms of dollars and cents, these plans aren't as far off from each other as you might think. So what happens a lot when people are looking at all their options, and for instance, they say, okay, my plan is going away. They want to look at, 2 or 3 plans side by side, and they want to see what the costs are. And the cool thing is you can go to Medicare.gov and you can actually compare options side by side in a very easy to use way. But just to kind of show you what people usually experience when this happens is they see that, give or take, these plans are much more similar than what they might think. So for instance, let's say you're looking at 2 Medicare Advantage plans and they both have $0 premiums, which is pretty common across the space. It kind of depends on like what state you're in, but here in New Jersey, there's a lot of $0 premium Medicare Advantage plans. Again, not all of them, but a lot of them. And let's say plan A has a $5 copay for a primary care visit, but plan B has a $0 copay for a primary care visit. Well, again, that is a difference, but it's not the end of the world. And then you can see plan A has a $10 specialist copay, but plan B has a $20 specialist copay. So you might be thinking, okay, well, I go to the primary once a year, but I go to specialists all the time. Maybe plan A now makes more sense. Then we can see, okay, Plan A has a $350 a day hospital stay, and Plan B has a $325 a day hospital stay. So again, we're looking at differences of like $5, $10, $20, maybe $50, and net, it doesn't always even out, but in a lot of cases it kind of does. Just from a top-down level, just so you know, in a lot of cases our biggest focus is just, does this plan cover someone's doctors? Does it cover their drugs? Because the out-of-pocket costs, while they do differ, As you can see, they're closer than you think. Most plans have a very similar out-of-pocket maximum. I kind of call it, it's not the same, but it's like the catastrophic maximum, like what happens in the absolute worst case scenario. But this number is actually set by the federal government in most cases. So this isn't like one plan has a $7,000 out-of-pocket max and another one has $20,000. They're all really subject to the same absolute ceiling. It's just some might take it lower than the federally regulated ceiling to make their plan a little more advantageous. But again, a lot of this stuff lines up very similarly. It just kind of comes down to your health care itself in most cases, not so much the out-of-pocket costs. So what do you think about all this? Is your plan leaving the area? Has your plan left the area in the past and you've had to switch? Are you looking to get into a new Medicare Advantage plan? Are you looking to get back into original Medicare? What is your thought about all this news and what we presented with you? Because we always want to know your thoughts. Please like and subscribe. Share this with somebody that you think would appreciate this, and leave us a comment down below because we're always looking to do new videos. And if you have a video you want us to make, we will most likely do it because we just want to help our community. We just want to do what we can. And if you want to work with Medicare brokers that care about you and work with you for life and want to make sure that you have the plan that you feel is best for you, work with the people here at NJ Life and Health. As I've said earlier, we have helped 5,000 people across 29 states with their Medicare. We have about 335 star reviews on Google right now, 1 4-star review, and nothing else. Our clients love us and we love them, and that's why we have so many happy clients. We will work with you. You can sit down with us for free. We will go through all your options. We will help calm you down, set the record straight on what you currently have. Does it make sense for you to switch? And as we talked about, there are no surprise changes each year because we work relentlessly to contact our clients at the end of the year to make sure that they are not surprised. So please work with us. Our phone number is 848-226-6897. Go to our website, www.njlifeandhealth.com. We have 3 full-time customer service representatives right here in America who can answer 90% of your questions related to Medicare. And we want to make sure you have the best possible experience with a family-owned and operated independent business. So once again, I've been Ken from NJ Life and Health. We love to work with you. Please like and subscribe, and we will see you in the next video.